antihistamines. These are the go-to treatments of conventional medicine. And yeah, they are effective, but you're going to be, again, you might be aggravating the condition because you're actually covering up for a deeper illness that's behind this. Or you're actually gonna, yeah, you're gonna get a relief, but for only for a partial period of time. Then it comes back again, and then suddenly you're so dependent on these medications, and it's the only thing you're hanging on to. That's why when we see eczema in integrative medicine, we always look into the gut. The gut is the one that actually is the protector of your immune system for specific foreign materials and not to get into your body to create these specific autoimmune reactions. And when you talk about eczema, eczema is induced by your antibodies, your own antibodies reacting to your own system. And that's why aggravating this would be the manifestation of this aggravation would be your skin having eczema. And you would notice this when you apply on creams that are not familiar to your system, or especially worse when you eat something, then you start to have the rashes. That's why when I focus on skin issues, I always want to make sure the gut is back to its normal, I guess, healed self again, so that your protection in the gut would be bulletproof, meaning there's nothing that would stimulate that immune system to create manifestations such as eczema, to actually show you that the immune system is screaming for help. But an integrative approach that we do for eczema lesions would be number one, a bicarb paste. You can actually get a glass of water, put bicarb in there, and mix it up, and make it into a paste. I mean, even a teaspoon would do. And once it's so thick, you can apply it on the lesion to make it dry. Just make sure that you're using, of course, clean material, because you're clean materials here, because you're worried about possible infection here. And because sometimes eczema wounds or lesions are deep in their cuts and microorganisms can get in there. So that's one that really helps out with terms of the dryness of your lesions. And that's a natural approach. Another one would be you can actually use, we have natural antihistamines, as we call it. These are stinging nettles, quercetin. Those are things that you can try also, and homeopathic remedies that we use here in the office. And if you want to go for IV therapies, we have hydrogen peroxide, definitely dries up that lesion faster. And if ever there's underlying infections that goes along with this eczema lesion that you have, it will also be taken care of by hydrogen peroxide IV drips. I hope that helps.
Okay, great answer. Hopefully that answers the question.
Can I run for president after this?
Yeah, please.
Too much coffee. No, actually, it's green tea that I'm drinking. So everybody drink green tea. Healthiest thing out there.
Really? Okay. Next question is, could you talk a little bit about hair regeneration and
Is this a male or a female?
Anonymous. So let's go male.
Okay, so if you're a female, sorry about this. No, I'm kidding. Well, the thing here is in assessing hair regrowth or hair problems, the one thing that you always need to think about is, number one, why I ask if it's a male, it's because of hormones. Hormones, in a sense that if it's a male, higher testosterone levels always are affiliated with hair falling. This is what we call androgenic presentation of baldness. You would see that this is a typical presentation of the baldness in men. And sometimes you need to control that testosterone level most of the time. But that's why I was specific about the gender, because for females, they really, testosterone can increase in these populations. But It's more of the thyroid hormone that we look into for females. But also this can be applied to a male too. But most of the time, women who has complained of hair falling or actually decreasing hair count on the scalp has found to be hypothyroid as well. And that's why I want to differentiate the most common hormonal reason for male and female. And another common one, which applies to both gender, would be stress. If you're in an acute stress, you would see that hair, and this happens to us all the time when we go through very extreme stress situations. That man, my hair is falling off. It's because the process of turnover of hair is accelerated because of the hormones that we secrete in the period of stress. And and the good thing about this type of hair loss is when the stress is gone, the hair loss will stop as well. And those are the two most common things that I can affiliate with hair loss. And some of the other reason would be there's an illness called trichotillomania, wherein yeah, it's a psychiatric illness. They pick out their hair, pull it out, and sometimes they even eat it. So these are extreme reasons, but these are the two common reasons. And for approaches and treatments, there's so many. There are now peptides that we apply to that, to the hair. It's zinc thymosin. Another one would be you would hear about hormone blockers. That's another one, and also hair transplants. But these are situations that it's not being conservative anymore. That's why we want to try. Yeah, we give zinc to our patients because zinc deficiency can also be part of that. We address if you're hypothyroid, we're going to give you some thyroid. If the testosterone is too high, we're going to put it down. So these are the natural approaches, but there are other more invasive approaches towards hair loss. More questions?
Regards to hair loss, is there anything in in the integrative medicine field that can help with that? Like, would you
So
recommend IV?
the hair loss, is that what you're saying?
Yeah, or yes. Like, would you recommend certain vitamin
Yeah.
regimens or IV treatment or acupuncture? Any thoughts?
Yeah. So as I mentioned a while ago, zinc. Definitely, you have to be on zinc because zinc deficiency can definitely get your hair loss accelerated if you're low on that. Another one would be biotin. So hair, nails, and skin. That's something that you can definitely take. And yeah, for yeah, acupuncture, I have seen that before, but again, it takes more sessions than the usual. Um, Another one would be amino acids, just because of course, as we all know, hair is an extension of our skin cells, and as we try to regenerate it again, amino acids plays a big role here. IV therapies, yeah, I mean when we talk about heavy metal, uh, I guess, levels in our system, it's a very systemic effect. And that's why mercury toxicity, lead toxicity can also lead to hair loss. And that's why chelation can come into play. And when we talk about, of course, um, vitamin deficiencies like zinc and B12 and folic acid, all of these can be infused in your IV drip, which we can give. And I want to make special mention of the peptide also. This is a zinc thymosin is what we call it. And this is something that you rub on the scalp area. And this is actually, it takes a little time to make this work, but I have seen patients who had success with this, but you really have to put time and effort to do this. And the price of peptides are not that cheap. But though this is a non-invasive approach, and I also have seen, well, yeah, scalp stimulators, but again, I really don't know much how effective that is. And uh, hair transplants, again, that's another expensive approach towards that. Um, but yeah, those are probably our go-tos.
Excellent. Thank you. The next question is according to this, I was recently prescribed antibiotics and it seems to have affected my digestion. I've been taking probiotics, but any suggestions aside from probiotics?
Yeah. So here, with the gut that actually got damaged by antibiotics, it's almost like throwing a grenade in your microbiome. Then it just dissipated everything that you have in there. And the thing there is, I don't know if you're currently taking antibiotics right now, or are you done with antibiotics? Because it's just more of an uphill climb or uphill battle if you're still currently on antibiotics. That's why, but it is still effective though. But it's not as effective compared to when you're in a situation that you're not taking any antibiotics anymore, because you're just more focused on rebuilding that gut. So that's why, if you are in that those specific states, I would still continue your probiotics. I'm just emphasizing that it's least effective when you're currently on antibiotics, but it's still, you're not losing the game. You're still in there. Something to boost the normal flora when you're done is prebiotics. Prebiotics is something that you feed your little guys, your microbiome. And what are these prebiotics? These are in the form of vegetables, fiber. You can actually take this in, of course, in a pill form too, but nothing beats the real deal. So you have to eat your actual vegetable or fruit to feed these guys. Because of course, when you take a pill, maybe it's just focused on fiber, but when you actually eat the food, the real deal food, you have the phytonutrients, the bioflavonoids, all the goodies that are not present in a supplement. And another one that would help your gut also after an antibiotic therapy would be digestive enzymes. You have to remember that a gut that is beaten up means that all the digestive enzymes are also starting to, it needs to rev up again, because it was not in that same state, in that normal state when you were on antibiotics. And giving digestive enzymes helps with digestion of food, so that absorption will be easier, thus less work for your gut, so that it can focus more on healing. um, those are the two good ones. Yeah, but adding prebiotics there would definitely be helpful for you.
So just that particular question came from someone that just said that they're not taking any antibiotics right now.
Oh, even better. So you can go crazy then. And yeah, you're not wasting your probiotics. You're paying good money for it, I know, and you're getting your money's worth.
Are there, here's another, are there any homeopathic treatments for eyesight? I'm guessing it's eyesight, like diminished eyesight.
Diminished eyesight. Okay, so there's so many different reasons on why eyesight can be diminished. I mean, depending on the I guess the diagnoses. And also, I mean, you would have the most common ones really why we're going to have a decreased eyesight would be, number one, in the aging group, would be cataracts. That's number one. Number two, for the younger population, it's more refraction errors, meaning you need to, I guess, get new glasses. So that's why there's so many different reasons on how we need to approach this. But homeopathic remedies are actually, it should be used in a specific situation. It's not like an aspirin in any type of pain. I can use that on to address maybe osteoarthritis, may it be rheumatoid arthritis or a back pain or a sciatic pain. That's why probably I can give you more of a generalized approach to that specific question. So the good eyesight homeopathic remedies would be I'm not sure if you're familiar with this, but aconitum would be good, especially if there's eye irritation or if there's yeah, it's more of if you have infections. Apis, the teary eye type of presentation. Arnica, if you have glaucoma, for example, that can produce eye pain, and glaucoma also can I mean arnica can help with that. Or if you have um, eyelash or corneal abrasions that's causing that eyesight to be altered, um, definitely arnica can also help with that because that's trauma induced and damage induced. So really depends. That's why the field of homeopathy, it's not like a one size fits all compared to conventional medicine. Like we have, if you have an allergy, I'll give you an antihistamine or a Benadryl. In this case, you also have to take note of the constitution or the. When I say constitution, this is going to go into the more complexities of homeopathy, but you're talking about the mental, spiritual, and emotional aspect of the patient. But in general, what I mentioned to you, those are the ones that we use for immediate problems. So I don't know if you're asking about homeopathy or a natural approach for eyesight problems.
They were asking for a homeopathic.
Okay, so those are the more common ones that we use, and really depends on the specific problem.
Um, so have you heard of? It's called ivermectin.
Ivermectin,
Ivermectin. What are your
yes,
thoughts on that as the new prophylactic for
for
COVID?
COVID. Okay, so ivermectin is actually an anti-parasitic drug, and it's all yeah. I have heard of I have heard of ivermectin in relation to COVID, and not in the U.S. though. That's not one of the recommended drugs for right now here in the U.S. And that's why it's still again the studies are not there for COVID-19. The thing there is I have seen other practitioners do it. Again, it's almost like yeah, hydroxychloroquine, but this one is really more specific for parasites, and it has that almost similar. It has some minor but almost similar effect to hydroxychloroquine, but it's not part of the recommended treatments right now. Again, it's not. I don't think it's going to be mainstream, though. I haven't tried it myself. I have, yeah, I have tried other things, but the studies are still on the tipping scale of yes and no, but and again, nothing really to vouch for on the medical evidence of ivermectin.
What are your thoughts on steroids treating COVID? Have you heard
Oh,
of?
that's a good question. It's well, the thing here, it's I don't want to say treating COVID-19. It's really more when you talk about steroids, it's lowering down the cytokine storm. So we always hear we're so probably overdosed with the word cytokine storm when we hear COVID-19. Cytokine storm is in a nutshell, it's a blast of inflammation enzymes that are being produced by the virus and also your body to protect your body from this specific insult. And because of that protection, the body is actually hurting the system itself. It has good intentions, but because of the overproduction of this enzyme, is just so detrimental and so taxing, especially for the ones who has comorbidities. And steroids actually dampens this cytokine storm, meaning this inflammation will happen, but it will not be detrimental for the system. That's why it is effective in a way as supportive, not as a therapeutic measure for COVID-19. And that's why this is where, of course, the seltemivir comes in, I saw, of course, the theorized hydroxychloroquine. Again, just going, I don't want to deviate away from the question. Steroids is supportive, and I have seen patients who actually responded, who had COVID-19, responded well to steroids, or specifically dexamethasone.
Paul has a question, so I'm gonna have him. I'm gonna unmute you, Paul. Go ahead, Paul, if you have a question still. No? Okay. Well, raise your raise your hand.
The silent type.
Raise your hand again if you come up with a question. So the next question we have is what? Hold on, sorry. Bad. What are the best IV treatments to help with inflammation?
Okay, for inflammation, the best one for that, which I actually used here for our Lucy, little Lucy, who actually has some inflammation going on. Yeah, she came in and complaining with aches and pains, and that's obviously inflammation. So I gave her sodium bicarbonate. So when um, when there's inflammation, we always think about, and there's pain with that. There's always the thought of accumulation of lactic acid. So lactic acid stimulates all these nerve pathways in a sense that it actually transmits more pain to the brain to say that, hey, there's inflammation. Hey, this is how I'm going to tell you I'm feeling it through pain. Lactic acid is going to be neutralized by anything that is alkaline. If only we can put a hose in our mouths and open up a faucet of alkaline water and let the body absorb that, that'll be great. But the best way really to give the full capacity of sodium bicarbonate or alkaline solutions is through IV therapy, because it's a systemic way of approaching it. And that's why neutralizing the specific lactic acid that is there just removes that strain on the nerve endings to make somebody feel better, especially if it's related to pain. And there's so many different types of inflammation here. I'm not focusing more on the inflammation that is only related to pain. You have to understand, for example, if you have a chronic infection that's sitting in your system, that also can cause inflammation, but it's a different type of inflammation. Sometimes it's even more detrimental if you have a chronic infection that's in there. And that's where other IV therapies such as hydrogen peroxide comes into play, ozone to kill that specific infection that's just sitting there and causing this low grade type of inflammation. So a better question for that is what type of inflammation it is, so that you would definitely know what to actually give to the patient.
I guess in line with inflammation, the next question is asking, does diet play a role in joint pain relief?
Big time, big time. Why? So let's talk about causes of joint pain. Causes of joint pain, there's so many different possible reasons for that. So number one, the most common one would be the wear and tear. Joint. So when you think about wear and tear, so you think of these joints rubbing together, right? And that actually, I guess, thickens up and produces inflammation, thus aggravating the nerve endings in that specific joint for you to feel pain. Now, the thing here is when you talk about diet, diet can come in handy when you're actually eating an anti-inflammatory diet. Oh, and basically the easiest way to state that is when you're eating more of plants, vegetable-based, fruit-based products than compared to animal products. These are your natural anti-inflammatories, such as you heard of turmeric, I'm sure. You heard of um, even curcumin, so they're all under the same family, and even the phytonutrients in vegetables are excuse me, are all anti-inflammatory. That's why when you eat more of the animal-based products, or even if you like sugar, especially sugar, they actually irritate these nerve endings to aggravate pain for you. And that's why I always want to, when I start a pain management program for a patient, I don't start a discussion about here's a medicine for you to take to relieve yourself from pain, because that again is just addressing the issue with a band-aid, and you're not really treating the actual problem there. But when you talk about the important issues such as diet, that's when you really start a good foundation for your treatment. Even for patients who are on chronic opiates, uh, again, you really have to have this goal of tapering them off. Even though you're going to be starting one patient with that, which I rarely do, but that should be the groundwork for a better foundation for you to have an easy tapering of that narcotic that you're going to be using. So yes, that I went through all that discussion, but the answer to that is yes. Diet is definitely a big player in lowering down inflammation, especially for joint pains.
Okay. The next one. So the next question is, my wife was recently diagnosed with glaucoma and is given Temoptic eye drops. Is there a natural alternative?
I'm assuming the eye drops that you're talking about is to lower the eye pressure of glaucoma, because with glaucoma again, uh, here's where we come into the picture of we have to, though we are integrated practitioners, we have to make sure that we also go back to our roots of still applying conventional medicine in the practice. When you're talking about glaucoma, this is a very serious condition. Why do I say serious? Because it's one of the leading causes of blindness if untreated or attended to. The thing here is, when I see a patient who has glaucoma, and I have this tendency to tell patients that, all right, if you're on a blood pressure pill, we're going to try to convert you to a natural, where we're going to do it slow. But in this case, when you talk about glaucoma, I would make my first line approach to this the actual blood lowering pressure of we call this intraocular pressure. But there's so many medicines for this, like a beta blocker, a calcium, an adrenergic blocker. And so it depends on. I think it's timolol that what you're trying to point out. Um, I would not replace this medicine with natural remedies for now, until we get the pressures controlled. The future question here is, if I do get the pressures controlled back to normal, would you taper me off timolol? Would you taper me off from that glaucoma medicine? That definitely is a very tricky line to jump into, for the reason that yes, maybe if you consistently take your pressures with your ophthalmologist, and if we maintain you on a good pressure here, but I probably wouldn't answer you to that and give you a false reassurance that yes, we're going to be taking care of that for good, for the reason that just the risk of blindness alone is very high if you let glaucoma go. The thing that I can probably, as if I am involved with this case, I can definitely add supplementation for it. Meaning you're still going to be on the timolol, I'm assuming, or the eye drops, and you're going to be using the possible supplementation or a possible homeopathic. I don't know if it's the same person who asked about the eye problems a while ago, but I would make you combine both in order for you or for your wife to have a lower dosage of the actual eye drop that you're using. So a good approach to this would be when you asked me about, if yeah, I already mentioned about the homeopathic remedies, but vitamin A is or lycopene is very good for the eyes, and zeaxanthin. I don't know if you're familiar with that. Those are also good for eye support. And of course, your vitamin C, your vitamin E's, tocotrienols. Those are definitely one of the better ones that I can add to your regimen. And I'm sure you heard of CoQ10 as well. That can also be added for eye health. Ginkgo biloba, bilberry. That's why I'm sticking more for supplements here. But one thing that I would suggest for you to look into, again, this is a field of uncharted waters, but there are studies about cannabis. Cannabis in the form of a good mixture would be THC, CBD. There are new studies out there now that it's not only CBD that works. The entourage effect combining THC and CBD together has been proven more effective than using CBD alone. And this is the old ways of thinking how effective medical marijuana can be. But that's something that you can definitely look into. Again, no medical evidences for this. These are new data that I just got into this conference recently, and they spoke about the wonders of medical marijuana towards glaucoma.
Thank you for answering that so thoroughly. So we're going to go back to COVID. So
Oh, COVID, everybody's best friend.
everybody's best friend in 2020. So if you are forced to take the COVID vaccination due to work, is there something naturally or organically or homeopathically you can take to kind of lessen the side effects of the vaccination, or maybe not have the side effects of the vaccination?
Yes, there is. So that's a pretty good question. Everybody's in this scare bubble now. If they're gonna get mandated to receive the COVID-19 vaccine, so I'm in that bubble too, because I've been hearing that healthcare professionals are gonna be part of that first line recipients of the vaccine. Meaning, are we gonna be the test subjects of that? Scary, right? But going back to your question, that's another talk for another day. The thing here is there is something that we actually can give you, and we are doing this in the practice already, not only for COVID-19 but also for other vaccinations such as the flu vaccine, pneumonia vaccine, because you have to understand that you of course you're given the microorganism, maybe dead or alive, but along with that are also additives or add-ons or fillers, heavy metals in these specific vaccinations, which can actually trigger effects. So you would hear about people getting fever afterwards, or having I'm just not feeling good after. The remedy that I would suggest, it's called Tui Occidentalis. This is a plant, and in homeopathic doses, it can actually negate specifically bad side effects of vaccinations in general. This is not only being applied specifically to COVID-19 vaccines, but it's in general anything that is vaccine related. This is something that we give. It can be in the form of oral, it can be in the form of injectable, it can be in the form of intravenous. But the preferred way or easier way, especially for children who just receive vaccines, we do it orally.
So we're pivoting to men's health, another men's health question. Are there IVs or treatments you'd recommend for men's health, in particularly AD?
ED. All right. So again, everybody is, and the men out there, all my patients who are they're curious about this specific illness. ED is not ED. Why? Why is that? ED is a symptom of something else. When I talk about ED as a symptom, the common thing why ED happens is, number one, cardiovascular system. If there is less blood flow going to downstairs, that is going to be a problem, because that's where ED gets is its source. The blood flow is impaired. If you have blockages for the blood flow to not go there, then you won't have that erection. And a big clue here would be cardiovascular diseases. If somebody's hypertensive, if somebody has high cholesterol, if somebody had a history of heart attacks, those are big clues for you that, hey, my circulation is bad and the blood is not going down there. So this thing here is you need to remove the obstruction. May it be from the inflammation, may it be from the cholesterol buildup, may it be from the platelets. Those are not really advantageous for the blood supply to be taken down there. Another reason would be hormones. So hormones is something that you need to fix. If you are, for example, low in testosterone, obviously there's nothing that's going to stimulate you down there to help it go up. And another one is nitric oxide. That's why the magic of Cialis, Viagra is there, because it provides more nitric oxide so that blood flow can be facilitated towards the erectile tissues. The thing here is, what can we give, how can we address that? IV therapies of what we call EDTA, chelation therapy, because it removes calcifications around your blood vessels. If you think about this, if this tube is filled with calcium, it's almost like your hose that you expose under the sun for the longest time, and if you try to bend it, it's not going to bend because it's all like hard and fried. But if you remove the calcium there in that specific blood vessel, now you're going to get that expansibility so that blood flow can be brought back into that erectile tissue downstairs. And it would help give, I guess, a relief for erectile dysfunction. But the key for erectile dysfunction is find the cause on what it is. And sometimes even PDE inhibitors, as we call it, or Cialis or Viagra, is only a band-aid to this specific problem. Even obesity, even cardiovascular diseases should be addressed because there's just so many links towards ED to these specific diseases. Even diabetes, you don't have receptors down there; they're all numb. That's why it's not standing up, and that's why it's really all about the key here is finding the real cause and not being focused on the actual symptom. Because sometimes we just want a quick fix, but it's really not. Especially ED is a chronic illness that's hiding.
Wow. More info than I could think about. So great, thank you. So we have a whole slew of questions regarding diabetes. So I'm gonna put it towards the end. We're gonna ask the questions that are kind of on other topics besides diabetes. So let me see here. Oh, and back to the Thuya in regards to the vaccinations. If you take Thuya, wouldn't that lessen the vaccine effects?
No, the thing there is Thuya is not focused on dampening the immune response. Thuya is focused on, again, Thuya is not a prescription medicine. It's not something that had been correlated directly towards the effects of the vaccine. It's a homeopathic remedy that is related to any untoward effect of a vaccine. If you ask me what is the mechanism behind that, I really don't know because it was never had been studied. The studies of homeopathic remedies are there, but again, it's never been ran in a, was you will always hear this a double randomized controlled trial. So in order for us to understand the real mechanism, homeopathy works as an energy type of approach, energy medicine. So when you introduce a vaccine, you're actually altering the energy flow of the whole system of the body. That negative effect of the vaccine is something that is going to be remedied by Thuya. Thuya will make that negative response into something neutral or positive. That's why when patients ask me, so what specific effect will I get? How would I know it's neutralized? It's just, of course, it's more of the symptoms that they feel after the vaccine. that okay, I didn't get the flu this time around. I didn't feel bad when I got that shot. And even in the longer term of things, for children, so we're worried about, of course, the so-called MMR related autism. That's something that is always going to be lingering, especially in moms that are so worried about it. And that's why Thuya is something that we give to these children who are actually getting vaccinations to neutralize this. But basically, the mode of action of Thuya, if you want a specific pharmaceutical literature about it, it's really not there. The homeopathic effects are the ones that will explain how this remedy is actually helping our immune system and our bodies build its normalcy again after a vaccination.
Okay, thank you. Okay, one more question before we tackle diabetes. So, why is Lyme disease so difficult to diagnose, and what can alternative medicine do to help treat it?
Okay. So, well, that's a good question. I was just actually talking to a patient a while ago about Lyme's disease because there was a certain diagnosis that just occurred with the paperwork that I got. With why is it hard? The reason for that is the testing of Lyme's disease is based on antibodies. Antibodies, they can stay and they can go. That's why we have IgM and IgG. IgM is something that's created when you get introduced with the microorganism and it spikes so fast and it'll be gone in a few days. IgG is something that lingers, it stays. Those are the certain tests out there that are available, and this is in the form of ELISA and Western blot. And just to show you how difficult this illness is, we need to do a two-tier testing, the ELISA, and then you do the Western blot afterwards to confirm the diagnoses. With Lyme's disease, it you would hear about this. They go into cells, they hide, and if you do a blood test, if they're in hiding, you might not catch them. And when you do, that's why the key for Lyme's disease is doing serial testing. When you do serial testing, meaning you do more than one test to diagnose a patient, and that's when maybe they are out now from where, because they can become cyst form, and that's how they protect themselves. And sometimes the blood test could not detect that and see that, and that's why when they come out, then you can detect it in blood again and through antibodies. And that's why it's a and Lyme's disease, or Borrelia as we call them, is a very tricky illness. It's a masquerader of almost everything. It could be you thought you're looking at an MS patient, you thought you're looking at a rheumatoid arthritis patient, and suddenly, boom, it just shows into your face that wow, this was Lyme's disease all along. And that's why it's one of the last resort type of diagnoses before you diagnose somebody with Lyme's disease. And again, there is now, okay, so I've been using something new on my patients, and this is very new. I really can't, I don't want to vouch for it in any way, but we are doing a new test for this along with other things. It's called a gene expression test to detect for Lyme. And I have seen better, I guess, reliability on this specific test compared to your regular ELISA and Western blot. And it shows how your DNA is expressing or fighting or genetic changes in your system and how it's fighting Lyme's disease. The only drawback of this test is number one, it's the price. It's very expensive. Number two, it's the waiting time. Most of the time, I would request for a test and would last. The waiting time would be lasting for a month, just because people are just jumping on it, and there's just so many patients that are getting onto this new test and who are actually getting results. But I wouldn't mention that specifically in this specific forum that we have, but I just wanted to get everybody updated on the new technologies of diagnosing Lyme's disease.
Thank you, Dr. Nario. Paul, I wanted to get to your question before we get into diabetes because there seems to be a lot of questions about diabetes. Did you want to ask your question?
I don't think I have any questions.
Okay, you had your hand raised earlier and we missed you, but
Well, I was confused with raising my hand and asking the question I asked already.
Oh, okay.
So I did both.
Well, good to
This
know.
was very informative. Thank you very much.
Oh,
Thanks, Paul, for being here. Paul is still in Chicago, right?
I'm still here.
All right. I hope you're staying healthy there, Paul.
I'm sequestered.
all right. So what I'm gonna do is I'm gonna ask one of the diabetes questions, and I'm gonna slowly unmute everybody. So if you just have a question, go ahead and just speak up. So the diabetes question we have is, if there's a newly diagnosed patient with diabetes, what advice can you give them as far of in regards to drinking alcohol and cutting down? I guess that's what the question is.
Okay. All right. We can't keep ourselves off the alcohol, but that's a thing. So alcohol in general for diabetes, I want to give more emphasis on beer. Beer contains carbohydrates. That's the thing. It actually increases your sugars. I mean, not sugars, but your carbohydrate load or glucose. I think that's a better term for that. That's why beer is something that I would, tell my patients to kind of stay away from as much as they can. Another one would be alcohol. Would be more on the sweet wine. So there is sweet wine out there, and though it's alcohol, you have to remember anything that's sweet actually adds to the sugar load of the system. Um, the recommended actual recommended drinks for I mean, not only for diabetics but in general for cardiovascular diseases, though diabetes is actually an endocrine disease or hormone disease, but you have to understand that diabetes also has an underlying cardiovascular problem. That's why most of the diabetics would have hypertension as well, and also would have heart issues, and that's the thing. Um, with cardiovascular also include diabetes in there. It's more of really dark the wine like Pinot Noir, the dark wine are the best ones out there that could actually be helpful for vasodilation. And again, you're thinking, why is he talking about that vasodilation and we're talking about diabetes here? It's just because of the underlying cardiovascular illness that goes along with diabetes. But in terms of lowering, increasing the blood sugars, those two drinks that I mentioned to you are the ones that you probably would stay away from. And now the question is how much? So one glass per night or a day is the recommendation for actual benefit of vasodilation effects, good vasodilation effects in the system. The thing here is the recommendation is, if you are not a drinker, don't even start. That's the best recommendation. But if you are a drinker already, if you're used to your wine, your alcohol, you limit it with one glass a day.
So so basically, if you are a regular alcohol drinker, let's say you drink about, I don't know, let's say about 3 beers probably every other day in that average, would recommend to cut down basically to 1 drink a day? Or can we do like a step down, like gradually? What do you?
Well, number one is with beer. Again, that's the one thing that you don't want to add into your system if you're a diabetic. If you want to change that to, I'm not promoting alcohol. But yeah, if you want to go for, yeah, sure, red wine. If you want to change that to hard liquor, sure, that's definitely better. But if you want to, going back to your example, 3 drinks every other day, that's actually putting yourself above the limit, for the reason that it's not really about spread accumulating it one day. It's really about the load that you're putting into your system during a session of drinking alcohol. So let me give you an example. When you get drunk and you get tipsy, your body's already telling you that, hey man, I can't handle that alcohol. That's it. I'm actually making you feel that the liver cannot metabolize it anymore. So if you get to that point, that's already a specific limit already. So sometimes tolerance can be different for everybody, because you have to remember that every I think there is the Native Americans, they have this enzyme, the alcohol dehydrogenase enzyme in their liver, that can make them drink more compared to, correct me if I'm wrong if I quoted this improperly, but they can drink more compared to the normal population. That's why they get tipsy a little later, or they need more drinks to get to that point. And that's why they're more prone to have liver issues, cardiovascular diseases. And that's why I don't want to I don't want to tell them, hey, you can clump it all up in one day and then abstain for the next few days and you're gonna be all good. It's just not, the body just doesn't work that way. Every time you put in something in your system, there is a limit for it and a tolerance, and you have to listen to that body of yours to understand when you have to stop and put the brakes on it.
So just to let you know, it's about 6:32. We can continue on if you want. We have a couple more questions. Does anybody have any questions that they want to ask live, Dr. Nario? No? Okay, so we have a couple more questions on the chat. In regards to diabetes, what lifestyle change do you recommend as a first step when a person is recently diagnosed with diabetes?
First lifestyle change would be, of course, diet. Diet is the biggest crutch of everybody. I mean, even for me, we're so used to eating the same things over and over again. The brain has been trained and modeled to eat the same thing that gives us pleasure. That's why the diet is also going to be intertwined with the psychological readiness of changing your lifestyle to something else. Because if you do change, let's say, yeah, if you do exercise, if you do, yeah, if you eat the right way, but if your mind is only, or your, if your, even your heart is getting forced to change because of diabetes, and you only would have you would have a poor prognosis with this type of approach, because you're not fixing the foundation of why you're really changing your lifestyle. That's why getting yourself ready mentally and even emotionally for, I mean, I would say a lifestyle change, not only for a few months change, is the biggest key for not only for diabetics but diagnosed with a new chronic illness. Because I see this in cancer. All right, with cancer patients, you tell them, hey, you have to be, let's say, vegetarian or vegan. You'd be surprised. These cancer patients flip around in one day. The next day they're going to tell you, all right, I'm vegan. Like, how did that happen? Because their motivation is so strong that they know that if they let go of cancer, there's not going to be a tomorrow for them. And that's why this is the effect of putting a patient in a situation that, is it really of dire need that I have to change? And if their perception is that way, then the change will happen. And this change has to be deep within a person or a patient in terms of how they perceive their illness. But again, the basic premise that I have to tell you or that patient who's newly diagnosed is, are you ready to change your lifestyle in exchange for a better health?
Anybody else have a question that they want to ask live? We have a couple more on the chat, or one more on the chat. It's regarding 5G. What? Okay, what can we do in the future if we're all forced to go on 5G?
All right. Well,
All our cell services in regards to our health, I guess.
yeah. And again, nobody really knows. The only way you could really protect yourself is what I mentioned a while ago at the beginning, but I probably can add more to that in terms of, I'm sure you've heard about turning off your Wi-Fi connections at home to lessen down the load. Because of course you have 5G running around, and you go home, you have Wi-Fi on. Those are like double insults to your system. So basically, what I'm saying is minimizing the exposure now, because 5G is not going to be just in that cell tower. It's going to be wherever you go. And you add what your Wi-Fi signal at home, and you put your cell phone to your head at the same time. So you're adding all these insults all on top of each other. And the key here really is just more of minimizing, turning off your cell phone when you go to bed. Don't sleep with it. Don't be hugging that phone, because it's still emitting radiation when it's there. And even, this is something, the wirings of your house, you can actually check the frequencies. There's a device that you can put around your house and detect the strongest areas that emits electromagnetic frequencies. And if you can find those and minimize those specific areas, that will be helpful. But again, the basic suggestion here is minimizing. It's not realistic to tell you that, hey, how can we avoid 5G if 5G is going to be part of our everyday lives? It's going to be tough. Unless we go to Mars.
Mars, it's like the purple unicorn.
There's still seats, I think, going to for that flight going to Mars.
Is that on the Elon Musk, that spaceship?
I think so. Yeah, I don't know how
On the
much tickets
Virgin
are,
flight.
or maybe not. They're probably sold out. Maybe the next one.
I guess. But how are you gonna bring all your IV treatments to Mars? Is that even gonna survive the?
I don't know. Gravity probably wouldn't push it in.
Okay.
So.
Right. So we've answered all the questions, unless somebody has any questions that they want to ask live. So thank you so much for participating. These were all great questions. Hopefully we've answered all of your concerns, eased your mind. We do this every month.